This is the Coronavirus Daily Briefing for Monday, March 23rd, 2020. I'm Brian McCullough. Covid-19 reaches the U.S. Senate. Pregnant women in New York City are being forced to give birth alone. Could the sudden loss of your sense of taste or smell be a sign you might have contracted COVID-19? Helpful new maps from a smart thermometer company, fears about what spring breakers might be bringing home, and big news on a big new vaccine trial. Italy has reported nearly 4,000 new cases overnight, and the country's total caseload approaches 60,000. There were 651 new deaths in Italy, bringing the total in that country to 5,476. But the increases in cases and deaths were both lower day over day, causing officials in that country to cautiously hope that the social distancing policies are beginning to have an effect in that country. Spain has reported 33,000 total cases, including 2,200 deaths, and in a development that is adding to concerns that healthcare systems will be completely overwhelmed globally, 12% of Spain's reported cases are of doctors, nurses, and ambulance drivers. The U.S. has passed Spain to become number 3 globally for the number of total active cases and is on track to overtake China, as well as possibly Italy, by next weekend in the number of total cases. Ohio and Louisiana are the latest states to implement stay-at-home orders. 3M says 500,000 N96 masks are on their way to New York and Seattle, quoting the Washington Post. 3M said it is ready to rush additional shipments across the country and will almost double production of the masks over the next year to an annual rate of 2 billion worldwide. That increase is bigger than the 30% boost the company announced on Friday. A 3M factory in South Dakota is producing 35 million N95 masks a month, 90% of which the company is selling for healthcare workers after a change in a law last week eliminated the threat of lawsuits from such sales, end quote. Senator Rand Paul tested positive for the coronavirus, and Senators Mitt Romney, Rick Scott, and Cory Gardner are also self-quarantining as a result. As of Sunday, New York City had more than 8,000 confirmed cases in the city alone, about one-third of the total reported cases in the U.S. There have been a total of 60 deaths thus far in New York City, quoting the Washington Post. New York Mayor Bill de Blasio said he expects the crisis to worsen in the coming weeks and months. April is going to be worse than March, and I fear May will be worse than April, de Blasio said on NBC News' Meet the Press. So, bluntly, it's going to get worse, a lot worse, before it gets better, end quote. De Blasio added that New York City is about 10 days from experiencing widespread shortages of essential medical supplies such as ventilators, end quote. 98 New York Police Department officers have tested positive for the disease. And in the larger state of New York, the death toll has surpassed that of all other states in the country over the weekend, including Washington state. The death toll in New York State has hit 114, with 15,000 total cases compared to the 1,700 total cases in the state of Washington. New York's total cases are now roughly 5% of total COVID cases worldwide. Governor Cuomo reported yesterday that young people aged 18 to 49 represent 53% of the cases in the state of New York. New York Presbyterian hospitals are enforcing bans on visitors during births at the hospitals, including banning partners and spouses of the women giving birth. In other words, women are giving birth in the hospital without the aid of their loved ones after pregnant patients tested positive for coronavirus. Dallas County in Texas has issued a shelter-in-place order. The Dallas Morning News says hospitals there may run out of beds by late April. As of Sunday, Texas had reported 600 positive cases of COVID-19. The United Arab Emirates has suspended all passenger airline flights by Wednesday of this week, which is a further blow to the global airline industry, especially if you understand what a huge international hub Dubai is for international flights. Infections inside prison populations continue to be a growing concern, along with prison riots and escapes, as we've already seen in Italy and other places. 23 people were killed over the weekend in riots that took place in prisons in the South American country of Colombia. There might be a new indicator that you have caught COVID-19 outside of the other symptoms like fever or cough that we have been hearing about all along. Doctors in the UK have said that asymptomatic people, that is, those not exhibiting the usual coronavirus symptoms of dry cough and fever, should be on the lookout for a sudden loss of their sense of smell and or taste, as that could be an early indication that they have contracted COVID-19. The British Association of Otorhinolaryngology said in a statement, quote, "There has been a rapidly growing number of reports of a significant increase in patients with COVID-19 infection presenting with loss of smell in the absence of other symptoms. Evidence from South Korea, China, and Italy suggests that significant numbers of patients with COVID-19 have developed anosmia, or loss of smell, as well as hyposmia, which is the reduced ability to smell. In Germany, it is reported that more than 2/3 of cases have anosmia. In South Korea, where testing has been more widespread, 30% of patients testing positive have had anosmia as their major presenting symptom in otherwise mild cases. Iran has reported an increase in cases of isolated anosmia, and many colleagues from the U.S., France, and Northern Italy have had the same experience. Professor Claire Hopkins, president of the British Rhinological Society, reports personally seeing 4 patients this week who were asymptomatic except for the recent onset of anosmia. Usually, no more than about 1 case is seen per month. These patients may have some of the hitherto hidden carriers that have been facilitated by the rapid spread of COVID-19. Unfortunately, they do not meet current criteria for testing or self-isolation, end quote. The association recommended adding loss of smell to the symptoms requiring quarantine and self-isolation so that, quote, "we might potentially be able to reduce the number of otherwise asymptomatic individuals who continue to act as vectors, not realizing the need to self-isolate," end quote. The smart thermometer company Kinsa says it may be able to track the spread of coronavirus in real time. Kinsa's internet-connected thermometers are in homes where up to 2 million people live, acting essentially as what the company's founder and CEO, Inder Singh, told the New York Times is, quote, "an early warning system for illness spreading." Because flu typically results in higher and longer fevers than the common cold, Kinsa has been able to use anonymized live temperature measurements logged along with zip codes to accurately predict the spread of flu across the U.S. around 2 weeks ahead of the CDC's own tracker, which relies on manual reporting from doctors' offices and emergency departments. The company has now launched a new mapping tool at healthweather.us, link in the show notes, of course, to show where there are unusually high and growing levels of fever compared to what would be expected in a usual flu season. Readings that could indicate the spread of COVID-19, for which typical symptoms include fever. Quoting from the New York Times, Kinsa's latest map of fever spikes shows areas that are known to have many cases of COVID-19, the illness caused by the coronavirus, but the data also points to spots in Florida, Michigan, Arizona, and eastern Texas where not as many cases have been reported. Just last Saturday, Kinsa's data indicated an unusual rise in fevers in South Florida, even though it was not known to be a COVID-19 epicenter. Within days, testing showed that South Florida had indeed become an epicenter. Quote, "we can't say for sure that these anomalous fever spikes are COVID-19, but we believe this is the earliest signal of where it's occurring," Mr. Singh said, end quote. A spokesperson for Kinsa told CNET, "We hope this map serves as a guidepost for public health first responders. If we see something unusual, such as an unexpectedly high level of illness, investigation needs to be done, and it needs to be done now so that we have the best shot at society's limited resources being put to their best use," end quote. Speaking of South Florida, fears are growing that spring breakers seen partying on the beaches of Florida over the last couple of weeks could become super spreaders of coronavirus when they return to their hometowns. Greg Gonsalves, a professor of epidemiology at Yale, told Politico, "What is happening in Florida with spring break partying on by students oblivious to the epidemiological implications of their actions is nothing short of tragic. While many of us have been hunkering down to try to break the chains of infection in our communities, these young people have decided the pleasures of the moment are worth bringing back the coronavirus to their friends and family," end quote. Florida has been criticized for being relatively slow to enforce statewide crowd control measures, leaving it to local officials to clear restaurants, hotels, and beaches of the usual spring break density of people. Miami Beach only shut down its beaches this last Thursday, with hotels substantially closed as of tonight. Quoting from Politico, Hansel Tooks, a public health physician specializing in infectious diseases at the University of Michigan's medical school, said no one knows how much the coronavirus has spread among spring breakers because of a lack of testing. Had there been enough tests, the students could have gone to clinics, and the sick ones could have been isolating themselves in Florida before going home. If there was testing, they could be isolated in, say, a hotel or a place where they could remain alone until they were no longer infectious, he said. Younger people have more social interactions. There's more transmission among them. Most people are infectious before they are symptomatic, end quote. Indeed, researchers at the University of Texas at Austin have found that the virus also spreads quickly even among people who are asymptomatic. 10% of patients are infected by someone who has no symptoms. So far, there's no sign of a spring break surge in Florida's safety net hospitals, which would potentially be more likely to take in a struggling spring breaker. But it's also too early. Infected Florida spring breakers are still incubating the illness, spreading the disease, and state officials don't know if there will be a surge in other parts of the country because they're not tracking anyone who has left Florida without symptoms, end quote. Obviously, for all our sakes, we need to avoid crowds in any way we can right now. But what if you need to go to the post office? What if you need postage to send out letters and packages? Don't worry, Stamps.com is here to help. Anything you can do at the post office, you can do at Stamps.com. Print postage on demand and skip those lines and crowds at the post office. Stamps.com brings all the services of the U.S. Postal Service right to your computer in the safety and comfort of your own home, office, or anywhere else you're hunkering down right now. Whether you're a small business sending invoices, an online seller shipping out products, or you're just working from home and need to mail stuff, Stamps.com can handle it all with ease. Simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send it. Once your mail is ready, just leave it for your mail carrier, schedule a free package pickup, or drop it in a mailbox. No human contact required. It's that simple. Right now, our listeners get a special offer that includes a 4-week trial plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing. Stay safe, my friends. This really seems to have been the weekend that the Covid-19 storm has started to hit the U.S. healthcare system in a major way. The head of surgery at New York Presbyterian in New York City, Dr. Craig Smith, posted a letter on social media late Saturday saying New York Presbyterian had about 300 COVID-19 antigen-positive inpatients with about 200 waiting test results. That would be a 50% increase in a single day. He's estimating that his hospital system will reach peak patient volume in 22 to 32 days, at which point his facilities will need between 700 and 934 ICU beds. That lower number exceeds their current capacity. And the resource problem is even more dire in other areas. Quote, New York Presbyterian normally uses 4,000 non-N95 masks per day. Currently, NYP is consuming 30,000 masks per day, which is estimated to reach 70,000 per day, end quote. He goes on to say that they were able to acquire 150,000 masks from a strategic reserve, which he estimates will last them around 2 days at peak caseload. Thus, the hospital system is rationing masks, one per healthcare provider, which the providers are expected to keep clean and reuse, perhaps for multiple patients and or multiple days. And ProPublica spoke with a respiratory therapist in Louisiana. The entire piece is worth reading to learn how his hospital has seemingly been taken aback by how quickly the onslaught has occurred there. And apologies, but I am going to read some of this because it's important to understand what the medical professionals are dealing with. Quote, with our coronavirus patients, once they're on ventilators, most need about the highest settings that we can do. About 90% oxygen and 16 of PEEP, positive end expiratory pressure, which keeps the lung inflated. This is nearly as high as I've ever seen. The level we're at means we are running out of options. In my experience, this severity of acute respiratory distress syndrome, or ARDS, is usually more typical of someone who has a near drowning experience. They have a bunch of dirty water in their lungs, or people who inhale caustic gas, especially for it to have such an acute onset like that. I've never seen a microorganism or an infectious process cause such acute damage to the lungs so rapidly. That was what really shocked me. It first struck me how different it was when I saw my first coronavirus patient go bad. I was like, holy S, this is not the flu. Watching this relatively young guy gasping for air, pink frothy secretions coming out of his tube and out of his mouth. The ventilator should have been doing the work of breathing, but he was still gasping for air, moving his mouth, moving his body, struggling. We had to restrain him. With all the coronavirus patients, we've had to restrain them. They really hyperventilate, really struggle to breathe. When you're in that mind state of struggling to breathe and delirious with fever, you don't know when someone is trying to help you, so you'll try to rip the breathing tube out because you feel it is choking you, but you are drowning. When someone has an infection, I'm used to seeing the normal colors you'd associate with it, greens and yellows. The coronavirus patients with ARDS have been having a lot of secretions that are actually pink because they're filled with blood cells that are leaking into their airways. They are essentially drowning in their own blood and fluids because their lungs are so full. So we're constantly having to suction out the secretions every time we go into their rooms, end quote. The doctor says he is seeing patients as young as in their 40s. He said that now that he has seen the disease, even if it is survivable for most, he doesn't want anyone he knows to come down with it because it is such a severe, nasty disease. Quote, I do not want to catch this, end quote. Finally today, on Friday, the World Health Organization launched a mega trial of 4 possible COVID-19 treatments. Called Solidarity, the study is designed to be as simple as possible to ensure that thousands of patients around the world are able to participate even as hospitals become overwhelmed with treating coronavirus patients. Quote, enrolling subjects in Solidarity will be easy. When a person with a confirmed case of COVID-19 is deemed eligible, the physician can enter the patient's data into a WHO website, including any underlying condition that could change the course of the disease, such as diabetes or HIV infection. The participant has to sign an informed consent form that is scanned and sent to the WHO electronically. After the physician states which drugs are available at his or her hospital, the website will randomize the patient to one of the drugs available or to the local standard care for COVID-19. After that, no more measurements or documentation are required, says Anna Maria Henao Restropro, a medical officer at WHO's Department of Immunization, Vaccines, and Biologicals. Physicians will record the day the patient left the hospital or died, the duration of their stay, and whether the patient required oxygen or ventilation, she says. That's all, end quote. The design is not double-blind, the gold standard in medical research, so there could be placebo effects from patients knowing they received a candidate drug. But WHO says it had to balance scientific rigor against speed. The idea for Solidarity came up less than 2 weeks ago, says Henao Restropro, and the agency hopes to have supporting documentation and data management centers set up next week. We are doing this in record time, she says, end quote. The 4 drugs included in the trial are remdesivir, originally developed to treat Ebola, chloroquine and hydroxychloroquine, the anti-malarial drugs that have been getting a lot of buzz as a potential treatment, ritonavir/lopinavir, a combination drug used to treat HIV infections, and ritonavir/lopinavir plus interferon beta. Interferon beta is a molecule that helps regulate inflammation. It's had positive effects on marmosets infected with MERS, and this triple combination is being tested on MERS patients in a randomized controlled trial in Saudi Arabia. Remdesivir showed no effect on Ebola when tested last year, but in test tube and animal studies conducted at the University of North Carolina in Chapel Hill in 2017, remdesivir inhibited the coronaviruses that caused SARS and MERS. Quoting Science magazine, the first COVID-19 patient diagnosed in the United States, a young man in Washington state, was given remdesivir when his condition worsened. He improved the next day, according to a case report in the New England Journal of Medicine. A California patient who received remdesivir and who doctors thought might not survive recovered as well. Such evidence from individual cases doesn't prove a drug is safe and effective. Still, from the drugs in the Solidarity trial, remdesivir has the best potential to be used in clinics, says Jiang Shibo of Fudan University in Shanghai, China, who has long worked on coronavirus therapeutics. Jiang particularly likes that high doses of the drug can likely be given without causing toxicities, end quote. The WHO did not originally intend to include chloroquine and hydroxychloroquine in the Solidarity trial, but ultimately added it since it has received so much widespread attention. Though researchers in both China and France reported using chloroquine and hydroxychloroquine to treat COVID-19 patients, the U.S. Society of Critical Care Medicine notes, quote, "There is insufficient evidence to issue a recommendation on the use of chloroquine or hydroxychloroquine in critically ill adults with COVID-19, end quote. The dosage required of chloroquine and hydroxychloroquine is usually so high that it can cause, quote, serious toxicities. Suzanne Harold, an expert on pulmonary infections at the University of Gießen, Germany, said of chloroquine, quote, researchers have tried this drug on virus after virus and it never works out in humans. The dose needed is just too high, end quote. As for ritonavir/lopinavir, the combination drug used to treat HIV, that has proven effective in marmosets infected with MERS and has held ambiguous results in SARS and MERS patients, but doesn't look too promising for COVID-19, quoting Science magazine again. Doctors in Wuhan, China gave 199 patients 2 pills of lopinavir/ritonavir twice a day plus standard care or standard care alone. There was no significant difference between the groups, they reported on March 15th. But the authors cautioned that patients were very ill, more than a fifth of them died, and so the treatment may have been given too late to help. While the drug is generally safe, it may interact with drugs usually given to severely ill patients, and doctors have warned it could cause significant liver damage, end quote. In addition to the Solidarity treatment trial, the WHO is also hoping to do a prevention trial of a similar model, which could be used to protect healthcare workers from infection. This podcast was produced by Ride Home Media. As I told you last week, if you need a break from coronavirus news, we have other daily news podcasts that might help put your mind on other things. Today, I wanted to recommend Celeb News Ride Home, which blissfully focuses only on celebrity news and gossip. So if you need something lighter to come down with after listening to this podcast, do give the Celeb News Ride Home podcast a try. Talk to you tomorrow. Be well.